Hi there, I'm Dr. Jim. I have an important topic. It's another COVID-19 topic, specifically related to nursing homes, and it's quite lengthy. Hang in there with me, bear with me if you will. This is COVID-19 and nursing homes, some lessons that we've learned. Researchers and writers from various disciplines have already published lots of findings. All you have to do is search for them on problems caused in nursing homes by the new coronavirus. Dr. Ouslander and Dr. Grabowski, in their article, COVID-19 in Nursing Homes, Calming the Perfect Storm. That's a good word for it. Point these out to lay a foundation for being better prepared if or when another epidemic or a pandemic should occur. Let's examine what went wrong and how to respond more appropriately and effectively. The nursing home setting itself is vulnerable to any type of outbreak, a cold or flu outbreak, for instance, which normally happen a couple times a year. Seniors live in close quarters with one another. The average age in most skilled facilities now is around 80. It's up there. Multiple illnesses known as comorbidities are very common, very common. Most nursing homes would have no need to stockpile protective equipment, PPE, personal protective equipment, for months out. Employee turnover and running short-staffed are fairly common, as is a very high turnover rate. Add these all together, and it's a disaster. It's a disaster waiting to happen, and the disaster did happen. To do a better job at protecting seniors, their families, and employees, intensive infection control procedures will need to be in place for the foreseeable future. It's no doubt that annual surveys will now focus heavily on infection control. Annual surveys have a theme every year: psychotropic medications, restraints, so on and so forth. Regular viral testing of staff, visitors, and contractors will need to become a part of the job. Ideally, testing should be weekly, if not twice per week. Temperature should be taken at the beginning of every shift, and if an employee indicates a high temperature, they just cannot work that shift, or they're going to have to quarantine for some time. Skilled nursing centers will have to provide all of the necessary personal protective equipment needed on a daily basis. Nursing home leaders can work with state representatives to ensure that they are on top of the list in receiving PPE and testing capabilities. Creating backup to direct care staff may be a difficult task for human resources, but it might become a necessity. When staff test positive, someone has to replace them temporarily. Communication with local agencies, facilities, hospitals may be beneficial before another outbreak takes place. Designating space in the physical plant of the building for residents who become infected can prevent the flow or the spread of the virus, or at least slow it down. Within the nursing home, look for larger space that can be used during outbreaks. Identify facilities in the community that can be converted into a temporary care center for quarantine. We should examine patterns of hospitalizations as well as re-hospitalizations and find ways to significantly reduce them. Reduce inappropriate transfers to emergency rooms. This can not only reduce hospital-acquired infections, it can reduce the need to quarantine residents returning from the hospital. So I have a much longer article if you're interested, COVID-19 in nursing homes, some lessons learned. Read it, share it, and thank you for spending time with me.